Afternoon, everyone. As you can see, we are back in Cedarville. As you know, yesterday morning, Fran and I found out that two people who work very close to us both have COVID. I was actually on my way to Akron and got the call and talked to the doctors and turned right around. Fran also had a full schedule ahead for the next few days. And so we both decided the best thing to do is just to pull back and not risk exposing someone. So we're going to be tested every day. We were tested late yesterday afternoon. That came back negative, and we hope continues to come back negative. The good news, let's turn to some good news. And the good news is that vaccination started yesterday for young people in Ohio, those 5 years of age and older. Earlier this week, the CDC and the FDA gave their final approval, authorization of COVID-19 vaccinations for 5 to 11-year-olds. And that certainly is just great news, what many families have really been waiting for. Over the last several weeks, we've been working closely with our providers around the state to prepare them to distribute this important vaccine, which is going to be available in all 88 counties. Right now, during this initial rollout of vaccines for 5 to 11-year-olds, a total of 367,500 pediatric doses are either already now in Ohio or are on their way to Ohio. It's noteworthy the federal government required that for the first week of ordering, that the minimum that could be ordered was 300 doses. And I know that caused some of the providers to pull back and say, we'll wait until next week when that 300 requirement is no longer there. Our daughter actually called one of the providers, and that's exactly what they said, that they didn't want to take the 300. They'll take what comes in next week. And so so many of them I anticipate will actually be starting next week as opposed to this week. But there are plenty of places out there right now. This will change, I said, in the coming weeks. That number will go down to 100 doses per shipment from the pharmaceutical companies. And in addition to that, in Ohio, we will be breaking those down further. Our health department will be breaking them down further for providers who want to take allotments of 50 doses. So that's how that's going to roll out. Providers are already administering vaccines over Ohio. We had officially 854 Ohio children aged 5 to 11 get the shot yesterday. Those numbers always lag somewhat, so it's probably a little higher than that, but we are starting. Today, the vaccination data update on our website at coronavirus.ohio.gov has a new column showing how many children 5 years to 11 have gotten their shot and what percentage that is of that population. In addition, we are starting to show a new number, and that number is people 5 and above. What percentage of that total population, 5 and above, is now vaccinated? As you know, we've been really focused on the 12 and above, and that's the number I usually cite. Now we will be looking at that 5 and above number to see exactly where we are every single day. Children are able to be vaccinated at many different types of providers, including local health departments, pediatricians, family physicians, community health centers, adult and children's hospitals, and pharmacies. Parents should contact their provider to learn about vaccination opportunities, or they can visit gettheshot.coronavirus.ohio.gov. Our younger grandkids are starting to get vaccinated today, and that's something we're very happy about. I think one family's children are getting vaccinated today. Another family is getting vaccinated tomorrow, and another family is getting vaccinated on Saturday. So that makes Fran and I very, very happy. Let's talk for a moment about Vax to School. Once a child gets their first shot, they can be registered to win a scholarship through the Ohio Vax to School program. We'll be giving away $2 million in scholarships and prizes, including 150 $10,000 scholarships and 5 $100,000 grand prize scholarships. These can be used at any Ohio college or university or any type of career training. Ohioans age 5 to 25 or their parents can enter online once they've received at least one dose of the COVID-19 vaccination. This is a significant date. The initial registration deadline is Sunday, November 21st. So if you want to have the opportunity to participate in all the drawings, you would need to be in then. Again, Sunday, November 21st. Full registration dates and the different rules and information, as well as the registration portals, are available online at www.ohiovax2school.com. That's ohiovax2school.com. The bottom line is the sooner that you register, the better chances you have to win. Ohioans age 5 to 25 or their parents or guardians can enter online once they've received at least one dose of the COVID-19 vaccine. We're doing well. Things are getting better. Every day we're seeing more Ohioans get vaccinated, and that's certainly a very, very positive thing. We've now reached a new stage in this pandemic where we're seeing children, younger children, now being able to get vaccinated. But I thought it would also be good as we celebrate that to really kind of take a look at really exactly where we are in regard to this battle against the coronavirus as we work to come out of the recent surge in cases sparked by the Delta variant. And again, no one has a crystal ball. I've asked Dr. Vanderhoff if he has a crystal ball, and he does not have one, and nobody does. We don't know exactly what is going to happen. What we do know is what has happened and what the trend lines are. Ohio is one of the later states to experience this Delta wave. But because Delta hit Ohio later than other parts of the country, we are currently one of the highest states of cases, hospitalizations, and deaths from COVID. I asked our team at the Department of Health to tell me how many people we had lost to COVID in October, the most recent full month. And they looked at that. They reminded me that death numbers are always lagging, and they don't always report instantly, or they don't report instantly. But as of today, there have been reported 1,264 of our fellow Ohioans who have died in October. Deaths occurring in October will continue to be recorded. That number we would expect to go up some. If you break that down on the numbers that are in now, that comes down to about 41 of our fellow citizens who who are dying every single day in Ohio. That is a lower number than we've had at certain times during the pandemic, but it still is 41 families who are devastated, 41 families who have to deal with that grief, and 41 families who have lost a loved one. A significant number of these deaths are now affecting a younger group of the population. And I think the numbers are really surprising. In October, this October, at least 173 of these deaths occurred amongst people in their 50s. At least 78 of these deaths occurred among people in their 40s. And at least 28 of these deaths occurred among people in their 30s. One of the most dangerous myths about COVID is that it only affects the old people. It does not affect younger people. That is simply not true. To try to put these numbers in some perspective, in October, we had the 6th highest month for COVID deaths at any stage of the pandemic. These numbers, I think, will surprise Ohioans when they hear about that. So we have the highest month except for December 2020, January 2021, November 2020, September 2021, and February 2021. So this October that we just finished was still the 6th highest month of our deaths. Because we have a higher percentage of older Ohioans who are vaccinated. In fact, nearly 75% of those over the age of 40 are now vaccinated. Many of these deaths and hospitalizations are occurring among younger and younger people because those are the individuals who are not vaccinated, or a higher percentage of them are not vaccinated. I share these figures and wanted to bring them to everyone's attention because I think it surprises people. At this point of the pandemic, we're all sick of it, well past being sick of it. We are all watching national news as well as local news. We know that nationwide, the cases are coming down fairly dramatically. We know that in Ohio, they are coming down. And I think the easy thing, if we're not directly impacted, if it's not a loved one of ours, the easy thing to do is to kind of think this is over with. There is, as Dr. Vanderhoff said yesterday, there's light at the end of the tunnel, and we think we can see the end. But if you're not vaccinated, the danger is still very, very high. So I would just, urge everyone, if you know someone who is not vaccinated, urge them to talk to their own doctor about whether they should be vaccinated. We are all certainly ready to be done with the pandemic, but tragically, the pandemic is not yet done with us. Our best tool remains vaccination. It is the number one, the number two, the number three tool. So again, we would just encourage everyone who's not been vaccinated to talk to their physician. As Fran and I have traveled throughout Ohio in the last several weeks, we've heard from so many of our fellow Ohioans just absolutely heartbreaking stories. People where we might be out to announce a water grant or a sewer grant or a new jail or something. And just in the conversation with people, average Ohioans who are there, somebody will bring up they lost a nephew 3 days ago, or their brother-in-law just went on a ventilator, or they lost a neighbor a week ago. These are deaths that are occurring now. These are tragedies that are occurring now. And in almost all of these cases, they are preventable. And if the person had been vaccinated, the odds are they probably would not have died. We just look at the number of people who go to our hospitals, and the numbers are just very, very high percentage of those individuals who are simply just not vaccinated. So it's just, these are gut wrenching to hear. And as we hear that, and as we look at the 40-some individuals who are still dying per day in Ohio, it does not square with, I think, what the feeling is that this thing is over with. We all want it to be over with. And if current trends continue, we will be down to a much safer level in a month or so if the trend lines continue. But until we get to that point, it still remains a very dangerous situation. For several weeks, our case numbers have been dropping, but you can see that they're at a very high level. We expect them to continue to decrease, especially as more people, including children who are 5 to 11, get vaccinated. But that is certainly going to take time. Let's look at our county slides. Eric, here are the numbers, and I know sometimes it's hard to read these, but they are available on our webpage. But we have a county that is almost 8 times high incident level of spread, 8 times what the CDC says is a high level. Even counties that are at the bottom are almost 2 times the CDC incident level of community spread. So the best county in Ohio is still at a danger level of 2 times that level. Again, here's today's dashboard. The highest county is Van Wert, followed by Guernsey, Defiance, and Seneca counties. All of these are approximately 7 to 8 times what is considered a high incidence of spread. Even when you go to the other end of the lowest county, Morgan County, is still above the rate of what is considered high incidence. Our statewide average, if you put everything together and look at where Ohio is, all of Ohio is, and blend it together, we have dropped, and we've dropped a lot, but we are still at 354 cases per 100,000 over a 2-week period, or more than 3.5 times the high incidence level. So as a state, 3.5 times. Let's go to the hospital slide. We know that the Delta variant spreads very quickly, particularly among the unvaccinated. We also know that the virus takes some time to make people sick enough to go to the hospital. When they do get sick enough to go there, they are very sick. As of yesterday, there were more than 2,300 of our fellow Ohioans in the hospital with COVID. Almost a third, 29%, are in the ICU. And of those in the ICU, 2/3 of them are on ventilators. Now, that's the bad news. The good news is that these numbers continue to drop, and we would expect them to continue to drop. But again, if that's your loved one in the ICU, that's certainly not any consolation. Vaccines are so very powerful. It's good news that we now have almost 65% of our population age 12 and over vaccinated. And now 67% of those, over 2/3 now, of those 18 years and above who are vaccinated. Also, if you notice from the previous slide, each state in Ohio, we're now averaging about 5,000 new people who choose to get their first vaccination. Today was higher. It was up into 7,000. But if you look back over the last few weeks, we're over 5,000. So that means every single day, 5,000 people who had, for whatever reason, not gotten their vaccine so far, chose to get the vaccine. And I think we need to celebrate that. I think that is a very, very positive thing. In October, so far, reporting, we've seen 153,163 new people choose to be vaccinated. That's 153,163. With children 5 and above now being able to get vaccinated, we have a new opportunity, frankly, to further knock this virus in the head. And the vaccine is the way we can do that. We're also seeing a significant number of people who are getting their booster shot, seeing a high number of that. And so that is certainly good news as well. So we'll take questions. Dr. Vanderhoff is also on here as well.
Governor, first question today is from Andrew Welsh-Huggins at the Associated Press.
Hi, Governor. Can you hear me okay?
Yes, sir.
Thanks a lot for doing this availability, and I'm glad to hear you're doing okay.
Thank you.
I wanted to ask about the OSHA releasing the rules today for President Biden's federal vaccine mandates. Is calling for companies with 100 or more employees to be vaccinated by January 4 or be tested weekly. Failure to comply could result in penalties of nearly $14,000 per violation, and there's some possibility of expanding this mandate to smaller employees or employers. So, Governor, what's your position on these rules, this new mandate, and what steps, I guess, would you see yourself taking either to support them or to block them?
Well, I think, I stated my position right after they were announced. My position has not changed. My position is that employers should not be told by government to vaccinate or require vaccinations, nor should they be told that they cannot require vaccinations. So I oppose the legislation that some of it is pending in the state legislature, but I also think what the president has done is a mistake as well.
Next question is from Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor. How are you today?
Good, sir.
Good. In the recent election, there were a lot of school board elections where there were people who were running specifically with a platform of trying to get rid of mask mandates in their districts. A lot of them were successful. A lot of them weren't. And there's a feeling that a lot of districts are now going to get rid of, mask mandates and leave it up to the parents. Where do you stand on schools still maybe having mask mandates, or are we at a point where it can be left up to the parents now?
Well, Scott, my feeling has not changed in regard to schools. These schools have the ability to do what they want in this area. But one of the reasons I wanted to go through some of the data of how this virus is still out there is just to remind everybody of that. And we know for a fact that having children wear masks in schools really stops the spread. So I would just urge schools, not to change that. I know some already have, but we are still at a high level. If we were not in a high level, I wouldn't be holding this press conference. It's the reason I'm holding this press conference. We are still at a high level. We're moving in the right direction. But I would just ask those schools to look at what the spread is, number of cases in their county, and look at the number of deaths in their county. Look at the spread, and that's going to tell them what the odds are of them seeing spread if people are not wearing masks. We know we had a whole year of kids wearing masks in school, and it worked exceedingly well. The end of this, we think, is in sight. These numbers are going to continue to come down, but they are still at a very, very, very high level. So that would be, what I would say in regard to that. Look at your numbers in your county. See where you are. Talk to your health department. See where, what those numbers are showing, or go up on our webpage and look at the numbers in your county. And I think that's going to help give people guidance in this area. Look, we tried to be helpful to schools and to parents and to kids in keeping them in school. When after we did the study was done in Warren County, we got those results back, kind of saw what was going on, saw what had been going on last year, and made the decision that we were going to loosen up the requirements in regard to quarantining. And I think it was the right thing to do. I'm proud of what we've done. But what I'm afraid is starting to happen is schools are looking at that and are saying, okay, well, then we don't really have to be masked. And they don't have to be masked, but I just think the prudent course is for another month or so until we get through this to stay masked.
Next question is from Alexis Moberger at WSYX in Columbus.
Hi, Governor. Question, now that the 5 to 11-year-olds have been approved to get the vaccine, are you now encouraging schools to host any vaccine clinics? I know in the past you've talked with some superintendents about the importance of masking. What about vaccines?
Yes, a lot of schools are going to do this. I think, if I remember correctly, about a third of the school districts have told us that they are going to allow clinics to take place. We've had contact, I know, by some schools saying we need help in finding a provider. So we've tried to help them line up a provider to do that. And look, a school can do this and no child is forced to get the vaccine. And no parent is compelled to have their child get the vaccine, but it makes it a lot more convenient if that can be done in a trusted setting. And our schools are very trusted settings.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor. Last week, 2 members of the Ohio State Board of Education resigned, including the president, who said you asked for her resignation. What is your position on the State Board of Education's short-lived anti-racism resolution?
Yeah, it was made clear to me by the Senate. They confirmed 3 and they didn't take up 2. It was clear that they were not going to confirm them. And so that's why I suggested that they resign. They didn't have to, but that's what I suggested that they do. I'm not going to get in a word game going back and forth today. I think my position, I've stated my position very, very clearly. We should teach, when we teach history, we should teach it the best we can about what actually happened. I'll be candid about it. There needs to be an understanding of the founding documents of this country. We should be very proud of our Declaration of Independence. We should be very proud of our Constitution. Yes, there was slavery, and we cannot minimize that and should not, and that has to be taught as well. But I think that we should not be doing anything that divides kids or divides parents or divides people in this country. It does not help for the child to be told that they might be a victim. It doesn't help really to tell another child that, they bear some guilt for something that happened in the past. So, my position is pretty clear. My basic philosophy about education goes back to what my high school principal told me many, many years ago. We were going into a new school building, and he said, look, this is a great new building. We're glad your parents voted for it, and it's going to be helpful to us. But remember, the only important thing in education is a student who wants to learn and a teacher who wants to teach and who's a good teacher. We've got a lot of good teachers out there. We need to focus on good teaching. We've got a lot of them. We should be very grateful for what they do every day. So that's my position on these issues. And, I suppose we could go on and on about it, but that's kind of where I'm coming from.
Next question is from Jim Province at the Toledo Blade.
Hi, Governor. It's
Jim.
good to see you. You mentioned that you were on the road last week or earlier this week. Can you tell us what you've been doing in terms of cooperating with any contact tracing that's been taking place in connection with some of these visits? And can you also give us an idea of some of the medical care that you've gotten over the last couple of days? If you've been doing anything in terms of a preventative care?
No, nothing. I've been following what the doctors have told me, which is, I didn't test positive. Fran did not test positive. In fact, we tested negative in a test that was taken from us about 4 o'clock or 4:30 yesterday afternoon. We will be tested again either later today or early tomorrow. We're going to continue to be tested. People who were in close proximity to the person who was with me in some of those travels who tested positive. I've reached out to some of them directly. We also, as you know, made it public. So anybody that was near me, I guess, will know they were near me. But I've not been, confirmed that I have COVID. I hope I don't, but we wanted to be very, very safe and not take a chance that I could be carrying it and not have symptoms and then go out and, meet people. So yesterday, I had a number of stops. Fran was going to be in 3 different counties. We were going to go out, and it just seemed the best thing to do is to stop and say, no, we're not going to do that. We're not going to take any chances with this COVID. This Delta variant is just more contagious, and it just is.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Hey, Joe.
Hello, Governor. Thank you for doing this. I have a question about the Redistricting Commission. You've kind of expressed that you weren't really hands-on, really involved in that was more the legislative leaders that came up with that. And you kind of expressed some doubts, kind of said you didn't really like it. You weren't totally there, but you'd vote for it anyway. The question is, your vote and Secretary of State LaRose, who's also made some comments about it, the 2 votes that you cast make a huge difference. If you don't feel like you're 100% behind what you're seeing, why are you continuing to vote with them? Why don't you, take a stand and say, I'm not going to vote for this until we get a better map?
Yeah. Joe, I think I've been through this before, but let me just kind of recap, and then we can talk about if you went to the congressional side of that as well, which is what we're heading into now. Look, my goal was to try to come out of this with a compromise. I looked at where each side was, and they were, in my opinion, they were not very far apart. They were, as I remember, about 6 or 7 apart as far as a projection of who would be likely to win one scenario versus another scenario, how many different seats. And I just, I thought that could be compromised and that was something I wanted to do. It became clear to me as we were reaching the 12th hour, midnight, that was not going to happen. Neither side was going to move. And so I was perfectly willing to take it into overtime and to just say, no, we're not going to approve this if I thought there was any chance of getting a compromise. But based upon the conversations I had with both sides, both the Republican side and Democrat side of legislative leaders, it was clear to me, and I think this opinion shared by Frank LaRose, he can speak for himself, but that we were not going to get people together. So at that point, you got one in front of you. We knew this was going to court anyway. We needed to simply move forward at that point. Supreme Court will tell us, and will give, if they change it, they'll give us instructions about about the issues, as far as how to arrive at that decision. But it was not anything that I was particularly happy about, and I'm sorry that we were not able to get a compromise. As far as the congressional maps, I've looked at the 2 from the Democrat side and Republican side. I think it's pretty clear neither one of these maps is going to fly. I think both of them are starting points for discussion, and I think they should be treated that way.
Next question is from Kevin Landers at WBNS in Columbus.
Good afternoon, Governor. Governor, you appoint members to the PUCO, and today John Cranley says if elected, he would fire all of them. Says basically they were complicit in allowing HB 6 to become law. What's your reaction to that, and do you believe the PUCO is looking out for consumers? Thank you.
Well, I guess the political season has started. I'm not going to fire him. I think his comments are, political comments at this point.
Next question is from John Reed at Gongwer News Service.
Good afternoon, Governor.
Afternoon.
Real quick, you have been going around the state talking about wastewater projects that were funded through American Rescue Plan Act dollars. Is there any plan for working with the legislature to get the rest of those dollars that have already come to the state appropriated? And do you expect any bill like that to happen before the end of the year?
Yes, we've been talking with the state legislature. This is something that is really a joint decision between the legislature and the governor. And we are approaching it from that point of view. We have a criminal justice package that we're working on, that we're starting to talk with the legislature about. We'll have more discussions with them, see where they are. But certainly that's one area. I know from the demand in regard to the water and sewer grants, that's also a possibility of something that we could plus up on this year's dollars or maybe next year's as well. So a lot of, I think, happiness out there about these grants, and there are a lot more villages and communities that need these grants than we can cover with the $250 million that we've already set aside. But those would be two potential areas. Legislature may have other things that they want to look at. We're also continue to look at the area of mental health, trying to move Ohio up in our ability to provide services throughout the state of Ohio for people who have a mental health challenge, and make that available no matter where they live, no matter what county they live in, is also something where you may see us come forward with some additional money. We've already set aside, as you know, the $80 million that goes to our children's hospitals in regard to mental health, but there's great need out there. And although Ohio, Lori Chris and her department, local departments are doing a good job, we still have room to go in regard to taking care of those people who have a mental health challenge.
Next question is from Dan DeRose at WOIO in Cleveland.
Good afternoon, Governor. How are you, sir?
Hey, Dan. Good.
Glad to see you're doing well. I'd like to get back to the two staffers. Obviously, we're not asking for who those staffers are with privacy rights and all that, but just would like to know, were these two staffers vaccinated, which would then make them considered breakthrough cases? Are they showing symptom signs? How is their health? Are they doing okay? Anything you could give us on that? And how close was your contact? And First Lady Fran, how close was contact with these two individuals?
With both of them, I was in the car with them for a good period of time. So that's one of the reasons of the, frankly, of the concern. They were both vaccinated. So was there any more? I'm sorry. Those are two.
Just asking, making sure they're doing well in their health.
Oh, yeah.
Are they showing symptoms?
Yes. I talked to one of them yesterday. Said, he's doing okay. I mean, he's got some mild, feels like he's got some allergies, but said feels pretty good.
Next question is from Haley B. Miller at Gwinnett, Ohio.
Hey, Governor. I have a question for both you and Dr. Vanderhoff. People who are eligible are starting to look at getting boosters for their initial dose of vaccine, but I think there's some confusion over what's the best booster to get. Should you mix and match? Any advice for Ohioans who are asking these questions right now?
I'll let Dr. Vanderhoff take that one.
Well, thanks. It's an excellent question. And the good news for all of us, I think, is that if we're in a category for which boosters have been recommended, what's important is to get the booster. As the CDC and the FDA looked at the data, it was clear that we can mix and match. Just because we received a Pfizer vaccine for our first dose doesn't mean we can't get a Moderna vaccine, for example, for our booster. The same is true for the Johnson & Johnson vaccine. If you received that, you're able to get one of the mRNA vaccines as a booster. So mixing and matching is perfectly acceptable. The key is, if you have been recommended, you really ought to think about getting it. Now, simply stated, who are those people? Well, for people who received J&J, remember that that was a one-dose vaccine. The booster would be recommended for anyone 18 and older who received that initial vaccination. Boosting now is recommended. In terms of the 2 mRNA vaccines, for the most part, it's people over the age of 65, plus people less than 65 but over 18 who might have a list of other medical considerations and or high-risk environments in which they work or function. So that's kind of it in summary.
Governor, next question is the last question for today, and it belongs to Shane Stegmiller of Hannah News Service.
Hello, Governor. I wanted to go back to the state school board. Are you supporting somebody for school board president? And also, what are your thoughts on some of these legislative proposals that would make the state school board a completely elected position rather than giving your office some appointments?
No, I've not done anything in regard to, expressing an opinion about who should be the president of the school board. As far as the second question, I'll take the position that I assume every governor would take, and that is that the ability to appoint people to the school board is important. Important the governor have the ability to do that. In some states, that person is a member of the governor's cabinet. In some states, that person is appointed directly by the governor. We have gone back and forth on this in Ohio, and we've come up with kind of a hybrid system where the governor appoints some people and other people are elected. And so, I'm not advocating for a change from, currently what we are doing. It's a mix, and you can make arguments why they all should be elected. You can make arguments why they all should be appointed. Ohio, in its kind of its way, has found this path, and I think this path is fine. Well, thank everybody. Hope everybody has a good day. Thanks a lot.